Zang Fu, The Organ Systems of Traditional Chinese Medicine by Jeremy Ross. Chapter 10 Shen and Xiao Chang, Heart and Small Intestine. Shen. Functions. Number 1. Roots Xue and Xue Mai. Number 2. Stored Shen. Number 3. Opens into the tongue, manifests in the face. The main functions of Shen are that it rules Xue and Xue Mai and stores Shen. The relatively more young function of Shen, the movement of Xue within Xue Mai, is closely related to the relatively yin function of Shen, that of storing or of providing a residence for Shen. This interrelationship is shown in figure 10.1. Of course, figure 10.1 is an oversimplification, since, for example, deficient Xinqi and deficient Xinxue may occur together and may be associated with deficient Xin'an or deficient Xin'an. Rules Xue and Xue Mai. The relationship between Xue, Xue Mai, and Qi has been discussed on page 9 and may be represented by figure 10.2. Zhongqi, the qi of the chest, is the movement of Shen in the heartbeat and the movement of Fei in respiration. It also assists Shen in the movement of Xue and Fei in the movement of Qi through the channel network and through the tissues of the body. Qi moves Xue and Fei rules Qi. Xue nourishes Qi and Shen regulates the movement of Xue. There is a very close relationship between Qi and Xue, Shen and Fei, and Zhongqi. Within Shen itself, Xinqi and Xinxue are mutually dependent and must be abundant and harmoniously balanced for heartbeat and pulse to be even and normal. Also, the state of Xue Mai depends on the harmony of Shen and Xue. Traditionally, Xue Mai is the tissue governed by Shen. Xue and Xue Mai do not exactly correspond to the Western concept of blood and blood vessels. TCM has little interest in the detailed composition of Xue and Xue Mai. It is concerned with their physiology and especially with their pathology. Also, the distinction between Qi and Xue, Jingluo and Xue Mai is often blurred. This is especially so in the case of Yin Qi, which closely resembles Xue and which flows with it in Jingluo and Xue Mai. Stores Shen. Shen rules Shen. In TCM, Shen is said to store Shen. Shen is the residence of Shen. Hence, in TCM, Shen is the seat of consciousness rather than the brain as in Western medicine. Shen requires adequate Xinxue and Xin'an to house Shen properly. If either or both of these are deficient, Shen has no residence and becomes disturbed. If Shen is harmonious, the mind is calm and peaceful, and there is clear consciousness and mental activity. If Shen is disturbed, the mind is restless, with insomnia, confused thinking, poor memory, or even loss of consciousness. Gan and Shen are the two Zang Fu most closely concerned with maintaining harmonious balance of the emotion and a smooth, adequate, and appropriate flow of reactions to environmental stimuli. If Shen is disturbed, there may be feelings of restlessness, anxiety, and panic. In severe cases, there may be confused, irrational, manic, or hysterical behavior, and insanity, delirium, and loss of consciousness. If Shen is deficient, the individual may feel joyless, lifeless, apathetic, and dull. If Shen is deficient, or especially if Shen is disturbed. The individual's emotions and behavioral responses are no longer appropriate, leading to further environmental disharmony. For example, manic and hysterical behavior are likely to cause difficulty in human relationships, and hence further problems for the patient. There is a close relationship between deficient yin, deficient xue, disturbance of Shen, and emotional disharmony. Deficient yin and deficient xue may originate or be originated by emotional disharmony. Similarly, disturbance of Shen may give rise to emotional disharmony or may be originated by it, either directly or via the chronic conditions of deficient yin and deficient xue. For example, insomnia may give rise to deficient yin and deficient xue, and hence to disturbance of Shen. Alternatively, disturbance of Shen, as in blazing Xin fire, may give rise to restlessness and insomnia. As discussed on page 12, the word Shen has been used in preference to spirit, since in Western understanding spirit implies the opposite of matter, animating it, but separate from it. In TCM, Shen has its material aspect. It is the manifestation of the activity of Jing and Qi, and is not separable from the functions of Xin and Xue. Manifests in the face, opens into the tongue. The complexion reflects, among other things, the state of Xin and Xue. If Xin and Xue are abundant, complexion is rosy and bright. If Xin and Xue are deficient, the complexion is pale and dull. The Essentials of Chinese Acupuncture states that the two main functions of Shen, controlling Xue and Xue Mai, and housing Shen, are closely related to the color, form, motility, and sense of taste of the tongue. The tongue is said to be the mirror of Shen. If Shin Qi and Shin Xue are abundant, the tongue is normal red and moist. If not, the tongue may be pale and flabby in the case of deficient Shin Qi, or pale thin and dry in the case of deficient Shin Xue. Stagnant Shin Xue may show us purplish coloration of the tongue, and blazing Shin fire may result in dry red tongue, with soreness and ulcerations. Disturbance of Shen by flame heat may involve a rigid tongue that is difficult to move, leading to stuttering. Hence, disharmonious of Shin may cause disturbance of speech, such as difficult or incoherent speech, stuttering, or aphasia. Patterns of disharmony. Patterns of Shin disharmony may be divided into two groups: those associated with underlying yang deficiency and those associated with underlying yin deficiency. Yang deficiency: deficient Shin Qi, deficient Shin Yang, stagnant Shin Xue, cold flame misting Shin. Yin deficiency: deficient Shin Xue, deficient Shin Yin, blazing Shin fire, flame fire agitating Shin. The foundation of Shin pathology are the Shin functions of ruling Xue and Xue Mai, and of housing Shen. Deficient Xue circulation and deficient Shen are associated with patterns of deficient Xin Qi, Yang and Xue. Deficient Xin Yang may lead to stagnant Xin Xue due to deficient Xue circulation, since Yang is needed to move Xue. Movement of Shen may be obstructed by phlegm or disturbed due to deficient Xue or deficient Yin, and especially by blazing Xin fire or flame fire. Origins. The origins of the deficient Shin disharmonies are illustrated in figure 10.3. Deficient Xin Qi. Signs. This pattern includes general signs of deficient qi, for example, pale face, shortness of breath on exertion, spontaneous sweating is intensified by exertion, lethargy, weak pulse, and pale, flabby tongue. It also includes the specific Shin sign of palpitation. Pathology. The general signs of deficient qi reflect the strong relationship between qi and fei, as discussed on page 139. For example, since fei qi and xin qi are linked via zong qi, deficient xin qi shows signs such as shortness of breath and palpitation, since deficient zong qi will affect both respiration and heartbeat. Also, since xin qi moves Xue, deficient xin qi may result in weakness and irregularity of pulse, reflecting in such pulse patterns as knotted or intermittent. The treatment. See deficient Xin Yang. Common disease patterns. See deficient Xin Yang. Deficient Xin Yang. Signs. The signs of deficient Xin Yang are as for deficient Xin Qi, but are often more severe, since deficient Xin Yang may be a progression of deficient Xin Qi, and with the addition of signs of cold. For example, aversion to cold, cold limbs, edema, deep weak pulse, and pale moist flabby tongue. Pathology. Pathology of deficient Xin Yang is similar to the pathology of deficient Xin Qi, with the addition that if Xin Yang is deficient, circulation of Xue is impaired, leading to chilliness, and cold limbs. If deficient Xin Yang is associated with deficient Shen Yang, Shen does not regulate Jin Ye properly, resulting in edema. If deficiency of Xin Yang becomes very severe, Yang may collapse with signs of profuse sweating, extreme cold in the limbs or entire body, cyanosis of lips, and loss of consciousness, with minute or imperceptible pulse. Yin and yang may separate, and the patient may die. The yang qi is very weak, resulting in extreme perspiration due to lack of control of the pulse, and extreme cold due to lack of movement of qi and xue. Failure to move xue result in cyanosis and minute pulse. Collapse of Xin Yang result in lack of nourishment of Xin, which fails to house Shen, with loss of consciousness. Differentiation between the patterns of deficient qi, deficient yang, deficient Xin qi, and deficient Xin yang is outlined in Table 10.1. Table 10.1. Comparison of the signs of deficient qi, deficient yang, deficient Xin qi, and deficient Xin yang. The signs of deficient qi. Bright pale face, spontaneous sweating, shortness of breath, lethargy, weak pulse, pale tongue. Signs of deficient Xin qi. Signs of deficient Xin qi is pulse palpitations plus knotted or intermittent pulse. Signs of deficient yang. Signs of deficient qi, but more severe, plus signs of cold. For example, aversion to cold, cold limbs, deep pulse, and tongue moist. Signs of deficient Xin Yang are signs of deficient Yang plus palpitations plus knotted or intermittent pulse. Treatment. For chronic heart disease associated with deficiency of Xin Qi and Xin Yang, A variety of points may be used to strengthen Xinqi and Xinyang and Shenyang using reinforcing method in moxa. Moxa is especially applicable if Xinyang is the predominant deficiency. Points may be selected from such as following: Jianxi, pericardium 5, Neiguan, pericardium 6, Tongli, heart 5, Shenmen, heart 7, Xiao Fu, heart 8, Shinshu, bladder 15, all of which strengthen Shin and pacify Shen. Qihai, Renmai 6, may be used to strengthen Qi and Yang, and Guanyang, Renmai 4, to strengthen Shenqi and Shenyang. Shanzhong, Renmai 17, may be added to strengthen Zhongqi, Xinqi, and Xinyang. Common disease patterns: arrhythmia, cardiac insufficiency, coronary arteriosclerosis, angina pectoris, general weakness, nervous disorders, and shock. Stagnant Xinxue. Signs: the patterns of stagnant Xinxue shows such signs as stabbing pain or stuffiness in the heart region, in which pain may be referred to the left shoulder and arm, or along Xinjinluo, purple face and cyanosis of lips and nails, palpitations, lassitude, shortness of breath, cold extremities, and choppy, knotted, or wiry pulse, and purple tongue, perhaps with purple spots. Pathology: just as deficient Xinqi may progress to deficient Xinyang, the latter may progress to stagnant Xinxue, so that all these three conditions may occur together. Here we have signs of deficient Xinqi, lethargy, and shortness of breath of deficient Yang, cold extremities of deficient Xinqi, palpitation and knotted pulse, and of deficient Xinyang, cyanosis due to lack of yang to move qi and xue. Deficiency of Xinqi and Yang, if severe, may impair the flow of Xinxue to the point where there is stagnation and obstruction of Xue in the body in general and in Shen in particular. This stagnation results in pain and stiffness in the heart region, which may be accompanied by discomfort along the course of the Shin channel. The impaired circulation and stagnation of Xue also result in the purpled face, tongue, lips, and nails, and in the choppy pulse. The wiry pulse reflects not only the stagnation of Xue, but also the pain associated with it, and is further emphasized when the condition is aggravated by invasion of extreme cold, external cold. Pain is the sign that differentiates this pattern from the other Shin disharmonies. If phlegm contributes to the Xue stagnation, there may be sensation of stiffness in the chest as well as, or instead of pain, in addition to such phlegm signs as greasy tongue coat. When this pattern is preceded by deficient Xinyang, it is an example of deficiency complicated by excess. Treatment: for angina pectoris associated with stagnation of Xinxue, the principle of treatment during the attack is to stimulate Xue circulation, to remove stagnation, and to reduce phlegm. Between attacks, the principle of treatment is to strengthen Xinyang and warm Shen and Pi. Reducing method is used during the attack, and between attacks, reinforcing or even method is used with moxa. Points, such as the following, may be used during the attack. Shimen, precardium 4, Xi point of Xinbao channel promotes circulation in the channels and collaterals of the chest to remove stagnation and pain. Important in acute heart disease and pain, and is specific for angina pectoris. Pacifies Shen. Geshu, bladder 17. Influential point for Xue. Invigorates Xue circulation, reduce phlegm. Shanchong, Renmai 17. Invigorates circulation of Qi and hence of Xue to remove stagnation and phlegm, especially in combination with Geshu. Between attacks, points such as the following may be used. Neiguan, pericardium 6, and Xue and Xue, bladder 14, regulates qi of Xin and Xinbao channels, and reinforces yang. Pishu, bladder 20, Zhu Sanli, stomach 36, Shenshu, bladder 23, Taishi, kidney 3, warm yang of Pi and Shen to transform the phlegm. Common disease patterns: angina pectoris, myocardial infarction, deficient Xinxue. Signs: the signs of this pattern include dull pale complexion, vertigo, insomnia, dream-disturbed sleep, poor memory, restless, anxiety, the state of being easily frightened, palpitations, thin pulse, and pale tongue. Pathology: the dull pale complexion, pale tongue, and thin pulse are signs of deficient Xue. Since there is insufficient Xue to fill and to nourish face, pulse, and tongue, vertigo may be a sign of deficiency in or deficient Xue, but when in combination with the former signs, indicates deficient Xue. Palpitations indicate, in this case, that there is insufficient Xue to fill and to nourish him. Insomnia, dream-disturbed sleep, poor memory, restlessness, anxiety, and the state of being easily frightened are signs that there is insufficient Xinxue to house Shen, so that Shen is disturbed. Treatment: deficient Xinxue may occur with or without deficient Xinyin. If alone, moxa may be used. If with deficient Xinyin, moxa should be avoided. In the case of insomnia due to deficient Xinxue, the principle of treatment is to strengthen and regulate Xin and Pi. The following points may be used with the reinforcing method. Amian, specific for insomnia. Intang, specific for dream-disturbed sleep. Shenmen, heart 7. Xinshu, bladder 15, are calm Xin and Shen. Invigorate circulation of Qi and Xue. Sang Jiao, spleen 6, and Pi Shu, bladder 20, strengthen Pi to produce Xue. In addition, the relatives of a patient may be asked to moxa intang and yongchan kidney 1 on the patient before sleep. Moxa is used here in insomnia due to deficient Xue, but may not be appropriate for insomnia due to deficient Yin or conditions of excess. Common disease patterns. Common disease patterns for this disharmony are insomnia, anemia, severe malnutrition, and depressive neurosis, such as postnatal depression following a hemorrhage during or after childbirth. Deficient Xinyin. Signs. There are general Yin deficient signs such as low fever, night sweating, mala flush, hot sensation in palms and soles, dry mouth, thin rapid pulse, and dry red tongue with no coat. In addition, there is the specific Shin signs of palpitation and signs of disturbed Shen, such as insomnia, dream disturbed sleep, feelings of unease and restlessness, anxiety and irritability. Pathology. There are palpitations and signs of disturbance of Shen, as with deficient Shin She, but in addition, there are signs of deficient Yin and of heat. When this pattern is associated with deficient Shen Yin, it's called Xin and Shen not harmonized. A vicious cycle is often set up, since living life in a perpetual stress, rush, and hurry can originate and greatly aggravate deficient Xin Yin. And on the other hand, deficient Xin Yin can give rise to the feelings of unease, restlessness, and anxiety the, that originate or aggravate the tendency to rush. This disharmony is common in women manifesting a deficient in type of menopausal pattern and may be accompanied by deficient Shen Yin and deficient Gan Yin. Treatment. The principle of treatment is strengthen and nourish Shen Yin and pacify Shen. If accompanied by deficiency of Yin and of Shen and Gan, Shen Yin must be nourished and hyperactive Gan Yang and blazing Gan fire pacified. If accompanied by deficient Xin Xue, then Xue and Xue must be nourished. Reinforcing method is used without moxa. For example, in insomnia resulting from disharmony of Xin and Shen, the following points may be used. Xiao Fu, Heart 8, pacifies Xin fire and calms Shen. Shen Shu, Bladder 15, pacifies Xin and Shen. Shen Shu, Bladder 23, strengthens Xin. Ingu, Kidney 10, strengthens Xin and dispels her heat. Taishi, Kidney 3, strengthens Shen Yin. Fenchi, Gallbladder 20, may be added if Xin fire is accompanied by rising fire of Gan and Dan. Common disease patterns. This pattern may be involved in the following: arrhythmia, tachycardia, hypertension, hyperthyroidism, and anxiety neurosis. Blazing Xin fire. Signs. The signs of this pattern include restlessness, irritability, insomnia, feelings of heat, flushed red face, thirst, bitter taste, dark urine, pain and or bleeding on urination, mouth and tongue ulcers, full rapid pulse, and red tongue, especially with red tip, central crack, and thin yellow coat. Origins. This pattern may be a progression of deficiency in, or may arise during some fevers by invasion of Xinhua, by pathological heat, and external heat may contribute here. Severe emotional irritation and stagnation can result in disturbance of Shen and in stagnation of Qi, which may then give rise to fire. In addition, excess consumption of spicy, greasy food may result in heat and phlegm, with blazing gunfire, which may then originate or aggravate blazing Xin fire. Pathology. This is a condition of excess heat, with feeling of heat, flushed, red face, dark urine, full rapid pulse, and red tongue with yellow coat. Heat gives rise to disturbance of Shen, with restlessness, irritability, and insomnia. But these signs are more severe than in the case of deficient Xin Yin. Xin opens into the tongue, so that blazing Xin fire produced redness, soreness, and ulceration of the tongue, especially of the tips. Tip, the area of the tongue that corresponds to Shen. The bitter taste results from excess fire affecting taste, which is partially controlled by Shen. It could be said that the face is red since Shen manifests in the complexion, but most patterns of excess heat also produce a red face. This redness is different from the malar flush of deficient yin, since it involves the whole face. Just as a pulse is full and the tongue has a yellow coat, in contrast to deficient in shin yin, where the pulse is thin and the tongue has no coat. These differences result from the difference between an excess heat and a deficient heat pattern. If Shin fire moves to Xiao Chang via their internal-external Zang Fu relationship, the fire in Xiao Chang may result in dark urine with pain and or bleeding and feelings of fullness in the lower abdomen. Treatment. The principle of treatment is to pacify Shin fire and calm Shen by using reducing method. For example, in glossities associated with blazing Shin fire, such point as the following may be used. Xiao Chang, Heart 9, while point of Shin channel, pricked to bleed to reduce Shin fire. Shen, Heart 7, in combination with Xiao Chang, reduces Shin fire and calms Shen. In addition, Chongji, Renmai 3, may be used with reducing method to eliminate damp heat in the lower jaw if heat has shifted to Xiao Chang. San Yin Jiao and Tai Xi may be used with even method to strengthen Yin and to support Xin Yin and in order to counteract the effects of Xin fire. Common disease patterns. This pattern may be involved in glossitis, and hyperthyroidism. It also commonly occurs in combination with other patterns, for example, with blazing gunfire in hypertension and hyperthyroidism, with fire in Xiaochang in some hem hematuria, with deficient Shen yin and deficient Xin yin in some forms of insomnia, and with flame fire agitating Shin in various forms of manias. Flame fire agitating Shin. Signs. This pattern may involve signs of insanity, raving, incoherent speech, violent behavior, laughing and crying without reason, perhaps loss of consciousness, slippery rapid pulse, and red tongue with yellow greasy coat. Pathology. This pattern of excess has similar origins to that of blazing Shin fire, but with a major difference: the predominance of flame, and the effects of the combination of flame and fire on consciousness, and the balance of mind and emotions. Signs such as insanity and violent behavior result from the combination of extreme disturbance of Shen due to heat and obstruction of Shen due to phlegm. The orifices of Shen are said to be obstructed, which in severe cases can lead to loss of consciousness due to obstruction of movement of Shen. The red tongue with yellow coat and the rapid pulse are due to heat, and the greasy tongue coat and slippery pulse are due to phlegm. Treatment. See cold phlegm misting Shin. Common disease patterns. See cold phlegm misting Shin. Cold phlegm misting Shin. Signs. Maturing to oneself, aphasia, depression, introverted manner, staring at walls, lethargic stupor, rattling sound in throat, sudden loss of consciousness, slippery slow pulse, and tongue with white greasy coat. Pathology. Like the previous category, this is an excess pattern in which Xing is obstructed by phlegm. But in this case, the phlegm is associated more with signs of cold than with signs of heat. It's a yin rather than a yang excess pattern, which is reflected in the signs of a mental and emotional imbalance, which are more yin and inward and less yang and extrovert than in the case of a flame fire agitating Shin. These signs are caused by phlegm obstructing the movement of Shen, which, when severe, may cause loss of consciousness. The rattling in the throat, slippery pulse, and greasy tongue coat reflect phlegm in the body, and the slow pulse and white tongue coat reflect cold. The extreme forms of these two excess phlegm patterns may be differentiated as follows. Table 10.3 Comparison of signs of cold flame mixing Shin and flame fire agitating Shin. Cold flame mixing Shin patterns. Yin yang, relatively in. Cold heat. Cold signs such as slow pulse and white tongue coat. Mental signs. Relatively introvert and depressive, such as staring at walls, muttering to oneself, lethargic stupor. Common disease patterns. Windstroke square, depressive psychosis, speech and mental retardation in children. Flame fire agitating Shin or flame fire. The signs of yin yang, relatively young. Cold heat. Heat signs such as rapid pulse and yellow tongue coat. Mental signs, relatively extrovert and manic, such as violence, shouting, laughing and crying, incessant or incoherent talking. Common disease patterns, severe, violent insanity, such as hysteria and manic psychosis. However, Table 10.3 creates an artificial distinction, since in practice the two patterns may alternate, oscillate, or transform into each other. Flame fire agitating Shin may be subdivided into yin and yang types, and flame misting Shin may show some heat signs. Also, both patterns may be complicated by the involvement of gum wind, and in the case of flame fire agitating Shin, blazing gunfire also. Treatment. The principle of treatment is to clear the orifices of the Shin and orifices of the senses by resolving phlegm. For flame fire agitating Shin, eliminate heat and calm Shen, and for cold flame misting Shin, open the channels to allow the suppressed emotions to flow. For example, in manic psychosis, points such as the following may be used. Hegu, large intestine 4, and Chuchi, large intestine 11, disperse heat from Yangming channels. Xiao Chang, lungs 11, it disperses heat, clears the mind, dispels madness. Daling, pericardium 7, Lao Gong, pericardium 8, and Zhenxi, pericardium 5, reduce heat in Xinbao channel, cool Shin, eliminates phlegm and calms Shen. Taichung, liver 3, Fenchi, gallbladder 20, Da Chui, pacify Ganyang, fire and wind, cleanse the yang which has been obscured by phlegm, pacify Shen and clear the brain. Dingshen, specific for psychosis. In depressive psychosis, points such as the following may be used. Wenchom clears sense and calms Shen. Ba Fui clears the senses and calms Shen, stabilizes the ascending yang. Si Shen Chong, Yamen, joined to Ba Fui, augments its action, clears the senses and consciousness, especially for incomplete maturation of the brain and stiff tongue inhibiting speech. Yiming combines with Yemen for incomplete maturation of the brain. Tongli, Heart 5, regulates Shin Qi, clears Shin, pacifies Shen, specific for aphasia. Neiguan, Pericardium 6, invigorates Wei and Shin, pacifies Shen. Fenlong, Stomach 40, as above. For mania, manic psychosis, reducing method is used. For insanity, depressive psychosis, even method is used, and moxibustion may be applied if appropriate. Common disease patterns. This pattern may be seen in disharmonies such as aphasia, epilepsy, speech or mental retardation in children, when stroke sequelae, hysteria, manic and depressive psychosis. Summary. The individual Shin disharmonies often occur together in groups and are often interwoven with the patterns of the other Zang Fu. For example, deficient Shinchi and Yang often occur together, sometimes with deficient Qi and Yang of Pi and Shen, sometimes with stagnation of Shen Xue. Deficient Shen Xue may occur with deficient Shinchi, with deficient Pi Qi and general Xue deficiency, or with deficient Xin Yin, perhaps accompanied with deficient Yin of Shen and Gan. Blazing Xin fire may occur with deficient Yin of Shen, Gan and Xin, with blazing fire of Gan, and with fire in Xiao Chang. Cold flame misting Xin and flame fire agitating Xin may occur with hyperactive Gan Yang, blazing Gan fire and Gan wind, so that the effect of flame, wind heat, and Yang disturbance may be inextricably interwoven. Shin patterns may be of deficient yin or deficient yang, cold or heat, deficiency of excess, or they may be deficiency complicated by excess, as in the case of stagnant Xinxue. However, in the main, the origins of Shin disharmony are internal rather than external.